So hello, everybody, and welcome. Thank you so much for joining us for another one in our series of Meet the Specialist with Dr. Ron Shnier. He is a radiologist, and he is also a neuroradiologist, and has numerous other areas of expertise, including musculoskeletal fellowship, and he's responsible for establishing one of Australia's first private MRI practices. His expertise across the field of medical imaging is pretty much unrivaled, and we are very, very proud to have him as part of our team here at MAG. He writes an excellent report too, and he's just a lovely guy to deal with. So without further ado, I will hand over and he can introduce himself, talk a little bit about the kinds of reports he does, and if you'd like to ask any questions at the end of that little session, please feel free. Over to you, sir.
Thanks for your kind words, Michelle. I'll just give you a bit of background. Yes, I'm a radiologist. I at Sydney University. I did my training at Royal Prince Alfred Hospital in Camperdown in Sydney. I then, my last year there, did a neuroradiology fellowship, and then in '91 I did a musculoskeletal fellowship at UCLA in Los Angeles. I went back as a staff specialist and then was headhunted by a private group to set up a private MRI service, which we did as a private facility in the St. George Hospital campus in Cogra. And after doing that, we then sold to a corporate, which is then HOA, which became Mayne's, which became Primary, which is now, I think Loomis is the last iteration. It was Helios. And I worked with them first as their national director of radiology, and then as their general manager. And then after Primary took over, I left back into private practice, a small group who, through various iterations, end up now working for IMED Radiology Network. We're the largest radiology provider, and I also am their chief medical officer. I have a great interest in medical legal work. When I started doing this many, many years ago, I used to get a file on my desk that was anything from 6 months to 3 years old, with a whole variety of other medical opinions. And one of the great things about changes in legislation over the year is it's become much more efficient and short process, which is always better for the person who's being injured or is unwell. So things evolved quite well. The other significant change over the years, when I started doing this work many years ago, it was generally the domain of retired doctors who had not read an article for decades. And it was their retirement fund. Today, they're much more informed and savvy specialists right across the board. A lot of them are young and still practicing, and I think that's been a good thing for the industry. When I write a report, it is of great importance that I know the relevant clinical history. I always take into consideration, secondarily to reviewing the images, what the various clinical specialists have said, and often there's some agreement, and other parts there is quite a lot of conflict, and that's because it's not a pure science. Often when a person has an injury and they have other comorbidities, apportioning blame can be quite difficult. My only message to this is, first of all, I need all the images, and today we don't look at film, it has to come in electronic form. The second piece is, the closer to the injury the imaging is done, the more accurate the report. You know, it's no point in looking at somebody who has back pain 3 years or 2 years after the injury, and they've got a lot of degenerative disease and disc disease, which the general population has. So closer to the injury, the better and more accurate. And then any progress imaging or previous to injury imaging is also very, very valuable. I try to keep the reports as short as possible, just try the relevance, and obviously always welcome feedback on how to improve, answer questions I haven't answered, answer questions that I might raise, giving my opinion. I think it should be a collegiate process, not a confrontational one. That's it in a nutshell. Excuse me.
I am Now I'm unmuted. Yeah. Before I hand over to others to ask a question, I have a question of my own. And I wondered how often in a medico-legal context are you asked to view images and then view the process of somebody's, for example, admission to hospital and the pathways that were taken? Are you often being asked to comment on whether that particular type of imaging should have been done or should have been done sooner, or whether a different type of scan or imaging should have been done?
So the answer is yes, quite commonly, but I'm very careful not to pass it to other people's specialty. So, if the question was asked, this patient had cervical spine trauma and a CT wasn't done for 3 days, but they had these and these and these clinical signs and symptoms, then it's very easy for you to comment that it's yes or no. While the clinical context is most important, and I'll often answer the question of what the most appropriate imaging and the type of imaging based on the clinical evaluation. But I don't comment or try not to comment on crossing into someone else's specialty.
Mm-hmm. Mm-hmm. And have you ever been asked to comment on a set of imaging of one sort or another, where clearly you might see something, but the person who ordered the imaging and assessed it at the time didn't?
That is common. So there's common to find something that someone missed or find something that someone else has misinterpreted. But what I approach it is this: it's not the previous person that's on trial unless it's medical negligence. It's more what is fair and reasonable for the injured party.
Right. That's actually nice. It's at the heart of our business here at MAG. We are all reminded every day that at the heart of each matter is an injured person. So nice to hear.
And we're all human, right? We all make mistakes.
Exactly, exactly. So would anyone else have a question that they would like to ask? Please feel free to unmute yourself and jump in. Ooh, looks like we answered everyone's questions. That's awesome. Look, thank you so much for your time today, sir. And to those of you who've joined us, this will go up onto our YouTube channel, and those who registered and attended and those who've registered but were not able to attend will be sent a copy of the recording. This is a really great way to get to know our specialists. So thank you very much, and go and have a great rest of the day.
Thanks a lot.
Thanks, Ron. Bye.
Bye.